Hi, Simon Wilson, doctor here at Preston Family Medical, talking about iron infusion. So iron we do need for our red cells, our oxygen carrying cells. If we're not getting enough iron, we can be fatigued, tired, and we can run out of puff. We haven't got enough exercise tolerance to do the things that we want to do. We've got three reasons really for low iron. One, we're not eating enough iron, we're not taking enough iron in from food or supplements. Two, we're taking plenty of iron in, but the gut, for genetic or disease reasons, has a hard time absorbing that iron. Or three, we're losing iron. We're eating enough and we're absorbing it okay, but we're losing it in difficult periods, in the bowel motions, or more rarely sort of surgery, trauma and accidents, and blood donation. So we want first to assess, why is the iron low? Are there simple things we can do first? Because we're always keen to do the simple things first, of course. So increase iron-rich foods. Think about having some acidic foods or juice with meals, which is shown to increase iron. Think about an iron supplement, and we can increase iron absorption with supplements by having them 1 hour before meals or 2 hours after meals, with something acidic, juice, a vitamin C supplement there as well. For some people, the simple cheap iron salts or iron sulfite can cause some gut problems and constipation, and although it is a bit more expensive, the iron tied to a sugar called Multifer brand tablets or liquids can be better absorbed as well. Think about giving that a red hot try. If we're really not winning, or we get the constipation and gut upset side effects, then we need to think about an iron infusion for you. That's having you here in the rooms, putting a drip in the arm, a soft plastic tube, into the vein, and slowly giving you a significant top of the line, a gram over 15 minutes. We often provide iron infusions here for our patients and other patients that are coming from other practices, and that includes people who are pregnant as well, and we offer that for women as per the Royal Women's Guidelines after the first trimester. So after 12 weeks we can offer an iron infusion in pregnancy, just not before. If you're coming in from another practice, we want a letter from your usual practice about why there's an iron deficiency, your recent bloods. We have a consultation here and then make a booking here. On the day, you're here for an hour. We do some baseline blood pressure and temperature checks, etc. We put the drip in the arm. Then we slowly give the iron over 15 minutes, and then we need to watch you for another 30 minutes as well to make sure there's no reactions. So do bring a book or some work, etc. Everything in medicine has some risks or problems. With iron infusions, there's two big ones and several small ones. The first big one is iron allergic reaction, anaphylaxis, that worst sort of allergic reaction that people who have bee sting or peanut allergies can get that requires adrenaline. This is very rare, less than 1 in 250,000 infusions, but is an accepted risk. The second risk is not really health affecting, but annoying, and that is iron staining of the skin. So we're very careful to keep the drip in the vein during the infusion. If iron leaks outside the vein into the skin, it in effect makes a tattoo, an iron or rust tattoo in the skin. This may fade with time. It may be a bit responsive to laser, a bit like tattoo removal, or it may just stay there. So it's not health affecting, but it can be, cosmetically significant with large areas of staining around the vein. This is rare as well, less than 1 in 500 infusions. With more minor reactions, there can be other reactions, like just some more mild allergic type reactions, some hives or skin itchiness that just responds to some tablet antihistamines. There can be some headaches and muscle aches as the body actually pulls up and uses the iron in the days following as well. We do have a private cost with the iron infusion to take account of the doctor, the nurse time, and the consumables. And at May 2026, this was $310. You're getting $125 back from Medicare as a rebate there. If you are coming to us from a different clinic, we'll then write a letter back to your regular practice and return you to their care for ongoing care. Aside from iron infusions, we do offer also a cluster infusions, so zoledronic acid. This is a medication to support bone strength for people with thin bones, osteoporosis. And we're also getting organised for the new Vypepti migraine infusion as well. So these also are going to become an option for people here. Hope that answers some questions about what to expect with iron infusion at Preston Family Medical. And if you or your own doctor have any questions, very happy to discuss, get in touch with the practice manager, and we can follow up from there. Thank you.